it's being comfortable and aware and making them feel that they are an individual and that they're not different in a strange way, that I'm making them comfortable and I'm talking to them like they are an individual just like I'm an individual, and bringing that level of comfort.
From the basement to the boardroom, from ideas to innovation, you're listening to the Beyond Clean podcast, the central nexus for the people, processes, and products that are pushing the sterile processing industry forward. Each week, you'll encounter diverse perspectives from subject matter experts across the country and around the globe. Frontline technicians, CEOs, engineers, and entrepreneurs with a common goal to help you fight dirty. Every instrument, every time. Whether you are tuning in for education or inspiration, we're glad you're here. Now, turn on those washers and turn up the volume. It's time to go beyond clean.
On this episode of Beyond Clean, we are going to be speaking with Dr. Erik Pearson. He's a pediatric surgeon. He's an educator, a mentor, and the creator of Citizen Surgeon. Very active on LinkedIn, Hank. And in this season, themed around conversations with surgeons and having them tell you the things they might not necessarily have the time to tell you in your day-to-day on the job, or maybe Hank and I will do a good job of asking him questions that you wished you had a chance to ask. That's what this episode is going to be all about today.
Yeah, Justin, the title of the episode is Tiny Lives and Tiny Instruments. And we're going to get into the human part of pediatrics, I hope, today, and then also dive in, to the differences between adults in pediatrics, how that impacts the surgeon themselves, how that impacts our job in sterile processing. In addition to all that, hopefully just inspire folks in the importance of your role in every context in fighting dirty every instrument, every time.
Don't go anywhere. We're going to be right back with Dr. Erik Pearson. I'm Justin Poulin.
And I'm Hank Balch.
From 17 Studios, you're listening to Beyond Clean, the global voice of sterile processing.
We are speaking with Dr. Erik Pearson, pediatric surgeon, educator and mentor, and creator of Citizen Surgeon, and also incredibly active individual on LinkedIn. And I'm certain, based on prior experience with Hank Balch here, that's how we found you. And so I want to welcome you to the show, and we're going to be talking about your experience specifically around pediatrics, which would make you the second pediatric surgeon we've had on the show. Our chief medical officer, Dr. Peter Nickel, is also a pediatric surgeon specializing in minimally invasive surgery. So thanks for coming on.
Absolutely. Thank you so much for having me. I'm pumped to be here, and thanks for a gracious introduction. And I'm excited. So let's see where this takes us.
I was thinking maybe you could tell us more about your experience, but also, why you began to get more involved on social media and LinkedIn as well. I'd like to hear kind of both components of your background and interest.
Yeah, I can start. Let's start with number 2. So why LinkedIn? So I'm going into my 6th year as a pediatric surgeon. And, when you talk to surgeons, in my experience in particular, it takes a few years to get that confidence to know that you can do the job, right? You go through training, but over 10 years of training, you're always working with an attending surgeon. And so those first few years out, you're getting your style, you're getting your confidence, you're figuring out how to do the myriad of operations. And so that was the first 5 years, and I'm continuing to learn. I'm continuing to get better. And I started Citizen Surgeon as a way to scale surgical education. And so that kind of brought me into this world of social media and this idea that you can reach way beyond the classroom, right? And so that's what's exciting. I gave a lecture to a few of the pediatrics residents, and I remember I took like 3 hours, 4 hours preparing this lecture, and I showed up, and there were like 7 people there, and, only half of them were awake and paying attention. I said, man, I put all this time into this thing and it's going to go nowhere. So I said, well, what if I put this on YouTube and anybody can watch it? And I've been able to touch all corners of the globe. And so that's been really exciting. And, then that trampolined me into LinkedIn, and LinkedIn's pretty neat. And what I like about the energy in LinkedIn is you can start to think about these bigger problems, these bigger issues, and you can bump into and collide with people who want to move the needle. And getting into conversations like this that not only improve your community locally, but you can start to build this network and think of bigger global problems we have in healthcare, we have in pediatric surgery, we just have in the community. And so LinkedIn I've really only been engaged the last kind of 3 months or so, but it's really exciting. Every time I get a post and people engage, I'm more excited about, how this network is going to help me move the needle.
Yeah, it's been awesome to see. And as you mentioned, it didn't take long. If you start adding value into the network on LinkedIn, like, people will flock to you, and they'll flock, for many different reasons. But as you said, there's all kinds of synergies that get created out of those conversations that create real value in the community and across healthcare. And I know we're going to have a lot of folks who are interested in your Citizen Surgeon organization. So we'll put a link and some contact information in the show notes so folks can kind of track that down and learn more, because it sounds like there's a strong education component to it as well, which is right in line with everything that we do here at Beyond Clean. So as we kind of transition into the topic around pediatrics, I am kind of curious, what drove your decision to go that direction in surgery? Obviously, you can go a million different directions. What kind of drew you into this particular category?
All of us, no matter where we're at, we have this why, right? We all build this why. And for me, that started really early. I think the first exposure in pediatrics was as a volunteer playmate at Seattle Children's. And so as an undergraduate, interest in medical school, we put ourselves in positions to gain experience. For me, one of my volunteer opportunities at Seattle Children's. And so I got to play with sick kids or kids that were in the hospital for a long time. That could be holding a baby in the NICU. That could have been playing basketball with a kid who was inpatient for chemotherapy. So that was the initial spark, right? And then in medical school, I rotated on pediatrics, and children provide this energy in the hospital, and this positive energy that's absolutely renewing, right? And the other thing I liked about peds is that the clock sort of falls off the wall. One thing I learned or I experienced as a resident was it didn't matter if it was 5 o'clock on a Friday afternoon. If somebody called and needed a pediatric surgeon's help, they were there. It was no questions. It was, oh man, it's Friday. No, happy to help. I'm here, right? And so that attitude, that commitment to me was really inspiring. And then, finally, I felt that my mentors were superheroes, right? In the morning, they could be operating on a 1 kilo infant sick with necrotizing enterocolitis. Then they could be in the trauma bay with a child that was a victim of a motor vehicle accident or even non-accidental trauma or child abuse. And then in the afternoon, they could be, talking with a pregnant mom that has a baby that has a congenital problem, and they're going to guide them through what that, postnatal experience is going to be like and how they're going to fix that child. So to me, there's no greater responsibility than taking care of somebody's child. I feel that way every day. I get chills thinking about that. And so pediatrics for me, like these sparks along the way, and then this continued reinforcement about how really important this job is and how much of a team sport pediatrics is. So that's kind of, and it's continually renewing. I am continually renewed by the people that I work with, and it's pretty inspiring every day.
You bring up an interesting theme here that I wanted to get to, and I guess now's a good time to dive into it, because I know on the outside looking in, as a sterile processing leader and technician. I worked first at just like a typical trauma hospital, and then eventually transferred into a hospital that had pediatric trauma. And so that was really the first time that we had a lot of interaction in that kind of pediatric service line. And what struck me most, like emotionally, was the first time I was in an elevator and there was just like a crib, like the surgical cribs, right? And it was empty, right? There wasn't even a patient in there. It was just an empty surgical crib, and it like hit me somewhere I was not prepared to be hit. And I was like, oh my goodness, like I've seen these instruments. I've seen the procedure names and everything, the ages, everything else, but that for some reason just pushed me over the emotional edge in a good way, but also, and this is kind of my question, I was really surprised that you just provided an insight on this is inspiring, like kids bring energy, because I kind of view it as the burden and the mental emotional weight is like so strong. How do you guys do it? But then you kind of spoke to, hey, there's an energy here that you actually get in a way that you don't get on the adult side. Can you kind of speak to that whole circle there?
Absolutely. And it's different over the different age ranges, right? So in a baby, let's say I have a baby with pyloric stenosis. I have a worried parent that has a baby that's been vomiting for several days and they can't figure it out. They get to the hospital, they get this diagnosis of pyloric stenosis. I'm providing a solution to that family. And when I take that baby to the operating room, that's the first time that baby's been away from that mom's arms, right? That's the very first time. And so that's an incredible responsibility to know that. Now, that emotional weight is heavy on, I got to fix this and I got to make sure that this baby is going to be safe. And I'm the guardian of that baby until I get it back in their mom's arms, right? With the team. But it's also this tremendously positive feeling that I can provide this solution, right? And as the ages go up, the approach is a little different. So for instance, in a 2-year-old or a 3-year-old or a 4-year-old, you have to win their trust, right? And sometimes in my clinic, that's sitting on the floor and pushing the roller stool back and forth, or it's knowing the Pokemon characters and wearing my Pikachu hat, or it's knowing the latest Marvel movie, and it's figuring out how to identify with that child. And then in the older age ranges, it's realizing that these older kids are part of the consent and part of the assent process, right? So it's not just talking with the parent and saying, I'm going to take your child to the operating room for a laparoscopic appendectomy and we're going to have 3 small incisions. It's talking to the child and realizing that, hey, this is what happens. What's going to happen? I know that it's scary. All right. And I'm going to be there with you the whole time and you're going to be safe and I'm going to take this pain away. Right. And so at all of these different age ranges, there's a different emotional connection. And with the babies, a lot of that is feeling the weight that this baby is this parent's world. Right. And recognizing too that it's not just me. It's our whole team, from the anesthesiologist to the scrub tech, the circulating nurse. I mean, we're all in this together, and that baby's not going to get through safely unless everybody feels that same commitment, that same responsibility.
I would not have found my way to healthcare if it weren't for children. I worked at a camp for children with disabilities for 5 summers. Originally, I was going to be an engineer. Then I wind up in nursing school as a result of that experience. And you're talking about all these different ages, but I also want to bring in disabilities to the equation, because you're talking about how you have to handle certain circumstances around different ages. And what I love about this is a lot of times, yes, the surgeon has contact, but people look at surgery. There are lots of people that are involved in surgery that are never really speaking to the patient, right? Patient doesn't have any interaction, but with the surgeon, that's uniquely different around the trust piece. So I wanted to kind of bring that to another level and talk about, what are some considerations for you around children with disabilities and at different ages and age ranges that way?
Yeah, you bring up a really important point because I deal with children with disabilities almost every day. A lot of kids that have neurological devastation from, an anoxic brain injury as a baby or a intracranial hemorrhage as a baby, and that carries throughout life. And those children have cerebral palsy, and then they have a range of needs, right? And so one is, for example, in our clinic, making sure that our clinic is a comfortable place for those parents to come, that when parents are facilitated by nurses, that they can get gurneys in and out, that they can get their wheelchairs in and out, that there's space to do that and that they feel welcome, right? And then as a surgeon dealing with kids with disabilities, it's being comfortable and aware and making them feel that they are an individual and that they're not different in a strange way, that I'm making them comfortable and I'm talking to them like they are an individual just like I'm an individual, and bringing that level of comfort and holding their hand, putting a warm hand on their forehead to comfort them if they're scared. It's being with them as their guardian almost when they're away from their parents. I work with children with disabilities a lot, and I feel that, I'm their guardian when they're away from their parents, for sure.
We hear so much about patient and family-centered care. Obviously, that's a whole different conversation in pediatrics than it is, and it's different. It's not necessarily more important, but I think there's a little bit more emphasis on it in general. And you're talking about the parents and their involvement and then being away. But I also, in my experience in working with parents who have children with disability, you talk about gaining the trust of the patient, the child themselves, but the parents often have some pretty bad experiences on the record in trying to care for their child and advocate, especially when they're limited access to funding or resources. I find that they have this sense of failure from the system, and the system doesn't have to be the healthcare system. That means a pretty broad thing for those parents. How do you also approach gaining their trust? Because, sometimes they're bringing some baggage to the table, and you've got to work with them and the child.
Yeah, the most important thing is listening, right? A lot of parents that have children with disabilities are very expert in that problem. And those parents bring a wealth of knowledge and experience and education. Many of those parents are part of communities, whether it's a Facebook private group or whether it's another community. In pediatrics, there are groups for holoprosencephaly. There are groups for congenital diaphragmatic hernia. These families, these parents bring in not only anxiety about their own child, but also stories from other families of what might happen and what they can expect. And so for me as a surgeon, sometimes the most important thing is just to put the brakes on and hear the story. Right? What are the problems they've had in the past? What are they worried about in the future? What have they heard? Some people will say, don't go to Google, don't go to online to research about something. I encourage that because the more education, the more knowledge they have, the more questions they can ask and the more helpful that I can be. So I encourage parents to be part of groups to get education, whether it's online or in a specific community. But to answer your question, the most important thing is listening and being empathetic, because those parents have been through an awful lot and they're continue to go through a lot. And it's not just the difficulties with that child, but there are challenges that parent's going to have with their other children. There are challenges that a child with disabilities might bring to a relationship. There are financial hurdles. So I think as a doctor who takes care of children with disabilities, and it's important to sit back and listen and hear what the story is and then help provide solutions. Sometimes those solutions are cutting and fixing something. Sometimes those solutions are, a listening ear.
I really appreciate the trajectory that this conversation has come, because we've spent a lot of time in the clinic setting, in the building of the trust. And then obviously on the clinical side, we know out of that conversation, then we get into the operating room, we get into the surgical procedure. And that's someplace that I want to spend the next couple of minutes really diving into, from the instrumentation side of things, because that's a big, in the world of sterile processing, obviously we view everything that we do through the lens of the instrumentation that we're sending, right? So like we know the procedure names, it matches up with specific instruments. And on the pediatric side, obviously that has implications to the instruments. And I'm kind of curious, in your perspective as a surgeon, how would you describe the differences that these instruments have on how they're used, the skills necessary to use them as compared maybe to the larger instrumentation that you would see in the adult setting?
So there are some commonalities, but then there are some very unique situations. And I think this is a really great thing to talk about. So number one, within like general trays, there are some instruments that are very specific because of the scaled down operations. So for instance, we might have Castroviejo 0.5 forceps, some smaller vein retractors, some Ryder needle drivers. And you'll find those, we'll usually have those in multiple pediatric hernia trays. But there are some specific instrument sets that are really important in pediatric surgery. So for example, rigid bronchoscopy. Okay. So rigid bronchoscopy is a tray that needs to be ready at a moment's notice because an airway emergency, an inhaled foreign body needs to happen right now within the hour. Okay. Most hospitals might have one rigid bronchoscopy tray, maybe two, and that is a very complex tray. There are a ton of little doodads and little screws and little rubber caps. And sometimes if just one of those is missing, for instance, the light adapter, then you can't use it at all, right? Knowing the difference between a pediatric rigid bronchoscopy tray and a rigid esophagoscopy tray, right? A lot of times they look the same. And for example, if it's a Saturday night and the call team doesn't work with the pediatric surgeons often and they're on and need to grab a tray, it's really important to know the difference between those two things. A couple of other things that are, different in pediatrics would be like the click line instruments. So we use a Karl Storz 3mm click line instruments. And if you're not familiar with using those, it's really hard to understand how do you switch between a Maryland and a scissor and a slotted grasper, or how do you get the pyloric spreader hooked up. And then, finally, we use things. So for example, Boulder Surgical, they used to be Just Right Surgical, makes 3mm sealers and 5mm staplers. And those are unique instruments. And so a 3mm sealer I might be using for a thoracoscopic lobectomy, or I might be using it for a pull-through in Hirschsprung's disease. And then the 5mm stapler I'll use in those operations, but also sometimes in a adolescent laparoscopic appendectomy where I want them to return to sports a little bit quicker. I don't want to make a larger incision in the umbilicus. I want to keep that 5mm. I'll use a 5mm stapler. And then I said finally already, but I could do a second finally. And that's that we use smaller telescopes. So for instance, we'll use an 18 centimeter, 2.7mm telescope through a 3mm trocar, and those are so fragile, right? So it's really important with those scopes, which are expensive, they're few in number, and they're really fragile. And we really depend on the optics for those scopes to operate on really small infants, is that they can be broken very easily. And so that's one of the challenges, I think, in the intra-operating room team is to be gentle with those scopes, and also an SPD to be gentle with those scopes. Because if we get to a point that I need to do, a pyloromyotomy in a little baby, and I'm counting on being able to see those layers of the stomach wall of the pylorus, and the scope's broke, it makes that more difficult.
Yeah, you're preaching to the choir on the importance of the quality of instrumentation, definitely, because, we do think a lot about that, but you bring up a good point. It's not just one team's responsibility to guard the quality piece. And this kind of, I don't know if this is a good segue or not, but I want to follow up on that list you provided to talk about preferences and expectations. And I know, you can speak from your experience, but hopefully you can kind of speak a little bit more broadly too about your pediatric peers. A lot of our jobs obviously has a very process-oriented kind of flow to it. We've got count sheets, we've got data that we're following, and we've got best practices that we're following. But inevitably, there are preferences on the part of our surgeons. There are expectations. And as we get into this pediatric space, the margin for error in some sense is even smaller than in the adult space. What kinds of preferences do you have regarding your instrumentation? And how does that play out in the preferences and experiences of your peers?
It's a great question. So first, I would say that as far as preferences, it's important that you have a key person that you're working with, that you can develop these trays, and that these trays have what you and your team needs. Now, in our hospital, all of the pediatric surgeons work very closely, and so we have general trays that all of the pediatric surgeons are happy with. And so that makes things a little bit easier from a processing point of view. One thing that we found is that since some pediatric instrumentation is very unique, for instance, a 3mm needle driver or a 3mm liver retractor, a circle ring liver retractor, or a 3mm scissor, it's important to keep those things in a peel pack so that while they're commonly used, we don't have to dig through tray after tray after tray to find them. And we found that in some operations where we might need a needle driver now and it's not in the pediatric fundo tray, or it's not in the pediatric, let's say, laparoscopic cholecystectomy tray, we can easily go get that. The other preference, or one thing we work on, is since a majority of our operations are urgent, in that we'll have a baby that's born and we need to fix that problem within a day or that same day, that the trays are ready and available, particularly with bronchoscopy, with rigid bronchoscopy. That tray always just has to be ready to go. And when it's not, another one would be like the Pena stimulators when we do imperforate anus repairs, being able to map out that sphincter complex. The very unique items have to be processed in a way that they're immediately processed and ready to go. So tomorrow, if I have a baby born that has a problem and I need those instruments, that we don't have to wait for them. Or if I have an emergency and I need those instruments, that they're processed. And I think that's one of the challenges when you have a small number of instruments that are very unique, is to keep on top of that and make sure that they're always available.
Yeah, it seems like awareness of the inventory and the risk points based on that inventory would be really critical. I almost wonder if a technology could really step up and help out with that, because, depending on the size of the department, how many people are new, that's very much institutional knowledge, what you're describing, or experiential. And it does require this collaboration with the surgical team too, to have that awareness. So you may be limited for sterile processing staff to have that. I think that was a really important thing that you just kind of shared. And there's a lot of takeaways by specifying these types of trays right? And the procedures and why it's critical. I think the why often gets lost. You know, you kind of get the wrist slap when something goes wrong, but to be truly proactive, it requires context to really be something that's memorable and will continue to resonate, which is why I say I think technology can certainly help, you know, the prioritization of those kinds of scenarios. And, you know, I think the other thing we told you before we got started is that this will go by very quickly, and it has. And I'm not surprised. I've really enjoyed this discussion, and you gave us some real good takeaways. We love, you know, really offering that up to the audience. And so before we close out, I kind of want to give you an opportunity in a couple of other areas, but there were some considerations and some key traits to focus on. But what about some key takeaways in terms of empowering sterile processing technicians or giving them some encouragement, something that you think might have helped you as a surgeon in your experiences or interactions with SPD? This really helped me. You should be empowered to do this for other pediatric surgeons as well.
Yes, and I'm glad you brought that up, because I think that sterile processing is sometimes a thankless position when it comes to the front line, and that you don't get a lot of pats on the back, but know that you are such an important part of the team. And I work with so Kathy is the scrub tech that I work with the most, and we work with SPD, and we try to get these trays in. And I will tell you that the other thing to think about in pediatric surgeries, we don't just work in the operating room. A lot of times we're working up in the NICU, and we're working and doing bedside ECMO or bedside XLAPs, and working with SPD to design these trays so that when we go up to the NICU and we're doing an operation at the bedside, we're not running back down to the operating room to get more instruments, and letting our SPD colleagues know how important they are in making an operation smooth. Because when we can just focus and we know the instrumentation is there and that we know that it's a high quality, I mean, that is one less anxiety, and that's more focus that goes to the baby, and it's a better outcome. So for the SPD community that's listening, you know, I can't thank you guys enough for all that you do. And it's a thankless job, but thank you, and you are appreciated. And you make such a difference when things are organized and they're high quality and ready to go. It makes our job much easier.
Well, I'm sure your team really appreciates you collaborating with them as well and making yourself available, because that is what teamwork is. And I think this was a really excellent interview. Lots of good, practical takeaways, and I couldn't echo that enough. Just the multiple hats that you wear as a pediatric surgeon. The specialization is children, not necessarily specific to type of procedure, right? As much as you might see, you know, with the general adult population and the way that specialization works there. So that was really important point that you made. Is there anything you want to add before we wrap? This was phenomenal.
No, I just want to thank you for having me on. I love talking about this. I love talking about the team to take care of children. And so this has been great. I look forward to listening to the episode.
That was Dr. Erik Pearson, pediatric surgeon, educator and mentor, and creator of Citizen Surgeon. We'll have some info about that in the write-up. Hank, I really have enjoyed this whole season so far. I know we've got several more interviews to do. This one was really excellent. It hit a little bit home for me, and I loved that Dr. Pearson brought up in, you know, talking about the challenges that, you know, a lot of his patients and specifically their family members experience when it comes to dealing with children with disabilities or having special needs. And obviously, if you're going in for a surgery, that's a pretty special need. And I liked that he brought up the fact that the parents of these children often become experts in the diagnosis, in the treatments, in doing that kind of research. And acknowledging that is really, really important because it's how they make their decisions. And as we bring that back to helping make critical decisions to put pediatric surgeons in the right position to be successful, I thought he did a really nice job of saying these sets for these reasons. And I feel like that's something that we can really all just put a little extra emphasis on and understand. And probably it would be difficult for a lot of people to have those kinds of conversations, even on the front lines. Maybe the managers and supervisors know it, but how do the people that are listening to this on a day-to-day basis that are going in there keep those things in mind if we don't bring that information to them? And it's hard to get all of it out there.
Yeah, Justin, I want to give a shout out specifically to all the children's hospitals out there, everyone that, you do this for a living every single day. It's pediatrics 24/7 for you. I know, as I expressed in the interview, there's a lot of hospitals that do pediatrics in addition to adults, but it's another world, working in those children's hospitals. And you see some of the cultural implications of that, like Superhero Day and like all the fun things, but also the weight and the burden that we kind of brought up and the energy. As you heard, that was kind of one of the surprising takeaways for me in this conversation. Is I was expecting to kind of hear, yeah, it's a grind, it's heavy all the time, but there is something else too about children that Dr. Pearson brought up, is they bring light and lightness and energy, even in the midst of some crazy, difficult situation. So I hope that was encouraging, to those of y'all out there in that context every day. And like you said, Justin, I think there were some good practical takeaways for everybody in just how they consider those emergent trays and those one-off trays and the critical importance to get those turned around as quick as you can.
And making a case for increasing inventory too. Yeah. Like we're trying to make rationalizations for that all the time. This is a great example of getting the types of information regarding the critical nature of certain trays and increasing that inventory, or peel packing backups of specialty instruments. I know we do that, but targeting which ones and why is really also, really important. And I thought that was great insights from Dr. Pearson. So another one in the books, Hank, but I do want to just tell everybody, do it right now. Download the smartphone app. That's right. Open it up. Get your phone open, go to the App Store, go to Google Play, type in Beyond Clean Podcast, download that app. Some of these episodes have bonus content you'll find there. We also categorize a lot of the content going out on the feed. You can search for topics that you want to learn about. And most importantly, while you're there, we want a rating and a review. But if you are listening to podcasts already and you don't want another app on your phone, I guess we get it. But that means you can find us on Apple, Amazon, or Google Podcasts. You can also find us on Stitcher, iHeartRadio, Spotify. There's a zillion podcast apps out there nowadays. Just search for Beyond Clean Podcast and you'll be able to subscribe there. We also love feedback. And if you related to the interview today, if there was just some feedback you wanted to send along to Hank or myself or the rest of the team at Beyond Clean, or maybe there's been another episode that's been particularly impactful on you and how you do your work, we want to hear those stories. We also want to hear if you've got ideas, like maybe there's somebody in the industry that's doing a great job that should deserve to be highlighted. We want to talk to them as a guest on the show. Maybe there's certain topics you feel like we've missed. And as you've noticed over the last few seasons, we've been bringing themes to our seasons. So if there's a theme idea that you have, we are always open to recommendations there. All you have to do is send an email to info@beyondclean.net. And on behalf of Hank and myself, thanks for listening to this episode of Beyond Clean.